Hi everybody and welcome back to my channel. Today's video is called Unlocking the Impact of Cancer on Your Sexuality and Your Sex Life. So in this video we're going to cover things such as if having cancer has drastically affected your sex life and also affected your sexuality. This video is for you if you have experienced changes in your sexual desires and relationships since you were diagnosed with cancer or even since you've become cancer free. It's also for you if you are feeling lost and confused about how to navigate the effects of cancer on your sexuality. And this video is also about exploring the crucial conversation around the impact of cancer on your sex life, and also to try and learn some valuable strategies in order for you to reclaim your sexuality. So let's get going then. So cancer can be devastating and a really devastating diagnosis with far-reaching impacts beyond that of physical health. And one of the most overlooked but essential aspects of cancer care is understanding the impact it has on a person's sexuality and sex life. It's essential to acknowledge and address its effect on intimacy and relationships, as well as any physical and emotional changes. This video is going to explore the impact of cancer on sexuality, and I'm going to try and provide some tips for managing its effect no matter where you are on your cancer journey. So first of all, the first question we're going to explore is what is cancer and its impact on sexuality? So cancer is a term used to describe a large group of diseases that occur when abnormal cells divide and spread uncontrollably. Cancer can affect different parts of the body, including organs, bones, muscles, and other body systems. It can also affect a person's sexuality and their sex life. Cancer can cause physical changes in the body, such as loss of libido, changes in sexual functioning, changes in body image, and can also cause sexual damage. It can also cause psychological changes such as depression, anxiety, and a fear of rejection. The impact of cancer on a person's sexuality and sex life can be emotionally and physically devastating. It can lead to feelings of loss, confusion, and sadness. It can also make it difficult to maintain intimate relationships, as well as causing feelings of low self-esteem. So cancer and its effects on intimacy. Let's explore that next. So intimacy is an essential part of relationships and of life in general. Cancer can have a significant impact on intimacy as it can interfere with physical and emotional closeness. Physical changes associated with cancer can make it difficult to engage in sexual activity, and these changes can include pain, fatigue, changes in your body, and also changes in libido. It can also make it difficult to be physically close to a partner, as certain activities may be uncomfortable or difficult. Cancer can also have a huge psychological impact on intimacy. So it can cause fear, anxiety, and depression, which may make it difficult to feel close to a partner. It can also be really difficult to open up about feelings, as many people feel ashamed or embarrassed about being concerned about their sexuality and their sex life alongside their cancer diagnosis. Let's just have a think about understanding the physical changes of cancer. So cancer can cause physical changes that affect a person's sexuality and sex life. And these changes, as we've spoke about, can include changes in libido, fatigue, pain, and also change in the physical appearance. So changes in libido can occur due to hormones, in medication, and also just the fact that you will be feeling extremely fatigued. Pain can also interfere with a person's ability to enjoy sexual activities, And changes in the body and in the body image can also make and cause discomfort, as well as make it difficult for a person to feel attractive or desirable anymore. So some cancer treatments can also cause physical changes, such as hair loss, weight changes, skin changes, and scarring. And these changes can cause feelings of insecurity, and it can make it difficult to feel attractive or confident. So, cancer has a massive impact on people's sex lives, and this is not just during the treatment process, but also in the aftermath. Sex is such an important factor in a person's quality of life, and unfortunately, medical professionals don't talk to patients about the side effects of the cancer treatment and the effect that this will have on their sexual lives. And this includes psychological and physical side effects. So medical professionals don't talk about it, and then that means that cancer patients don't ask about it at the time of treatment, as when you are having the treatment, sex and your sexuality, it will be the furthest thing from your mind. But this is more than just thinking about your appearance and what you're going to look like after after the cancer treatment. So first of all, just thinking about chemotherapy and radiation. This causes damage to the mucous membrane of the body, things such as the mouth, but also the vulva and the anus are also mucous membranes, and this can cause the skin to become painful, it can burn the skin, and it can affect the sensitive tissue, making the genitals numb or oversensitive. Anti-hormone treatments lower the desire for intimacy, they reduce libido, and they also mess up the body's ability to orgasm through things such as affecting the pelvic floor muscles. Blood flow is also reduced, which is needed to make our private parts plump and moist, causing little to no lubrication. And key parts of the sexual anatomy and our sensual selves are damaged, which has long-term consequences on sex and libido long after treatment has finished. People are left feeling asexual, which has a profound impact on their quality of life. Additionally, it can be hard as a person's partner who can find it hard to stop being the caregiver and start seeing that partner as a sexual, sensual being once again. So sex is high on the hierarchy of human needs, and medical professionals need to start addressing this with patients, especially as the survival rate increases, people are living longer and are having to spend a long time with the aftermaths of cancer, suffering from poor, painful sex. So cancer patients really do need to think about their quality of life after cancer and after the treatments are over. And doctors are so focused on the medical treatment. So if you go see your doctor and they don't bring up the side effects of treatments and what the side effects can have on your sexual life, then you really need to find the confidence and bring it up for yourself. Let them know that it is important to you and ask these questions to your doctor. Will this affect my sexuality? Will this affect my ability to function sexually? Will this affect the sensation that I feel with or during intercourse? Don't wait for your doctor to bring it up, as if you wait, they're probably never going to bring it up. So just having a think now about exploring the emotions and the psychological effects of cancer on sexuality. So cancer can cause emotional and psychological changes such as depression, anxiety, and fear of rejection or abandonment. And these changes can make it difficult to open up to a partner and can cause feelings of low self-esteem and fear of rejection. So depression can make it difficult to feel pleasure, as well as make it difficult to be intimate with a partner. And anxiety can cause fear and worry, which makes it difficult to relax and enjoy sexual activities. Fear of rejection can also make it difficult to open up to a partner and can lead to feelings of insecurity. So it is important to recognise these emotions and to seek help if needed. talking to a counsellor or a therapist can help to address these emotions and provide you with support and teach you some coping strategies. So now I just want to talk about some tips for managing sexual changes after cancer. Sorry, I'm full of cold. So there are a few tips that can help manage sexual changes after cancer or even with ongoing cancer treatment. And the first is to talk to your partner, obviously, if you have one. So communication is key in any relationship, but it is especially important when dealing with a cancer diagnosis. Talking openly and honestly about feelings, concerns, and needs can help to strengthen relationships and foster a sense of closeness and understanding. So the second tip is to explore different ways to be intimate. So while sexual intercourse may not be possible or may not be comfortable, there are still ways to be physically close to a partner. And this could include cuddling, massaging, or just exploring any other forms of physical contact, such as rubbing in some lotion, brushing your hair, anything like that. So the third tip is to take things slow. Cancer can cause physical and emotional changes that can make it difficult to engage in sexual activities. And it's important to remember that it's okay to take things slow and to explore what feels comfortable and safe for you now. So next, we're just going to identify some resources for managing cancer-related sexuality. So there are many resources available to help manage cancer-related sexuality, and this does include talking to your doctor or medical professional, or talking to a therapist, joining a support group, or also just doing your own research about cancer and sexuality using the internet or books. Talking to a doctor can help to address any physical changes that are caused by cancer and can provide you with information to manage them. A therapist can help you to address the psychological and emotional effects of cancer and provide you with those coping strategies. Joining a support group can also be really beneficial, and this can provide a safe and understanding space to talk about feelings, concerns, and experiences with people who are going through similar situations. Reading books and articles about cancer and sexuality can also be helpful by providing information and helping to normalise the experience, knowing that you are not alone. So supporting a patient who is supporting a partner who is affected by cancer. When a partner is affected by cancer, it can be difficult to know how best to support them. And it's important to remember that everyone's experience is different, and it's also important to respect their feelings and their wishes. So the first thing to do, you'll be really surprised, is to listen and to be supportive. Make sure to check in with your partner regularly and ask how they are feeling. And it's also important to be understanding and to be really patient. It is important to provide emotional support and just let your partner know that you are there for them and that they can talk to you about anything. It is also important to remember that your partner may need more time and more space than usual. And it's important to give them that time and space that they need and come to you when they're ready and comfortable. That is not a reflection on you, that is just usually their way of coping and dealing with things. So how can we re-establish intimacy after cancer treatment? Sorry, I'll just have to have another sip. So re-establishing intimacy after cancer treatment can be difficult, but it is possible. And the first step is to talk to your partner and understand their needs and feelings. It's also important to take things slow and explore different ways to be intimate. The next step is to explore what feels comfortable and what feels safe. So this could include talking about your feelings, it could include exploring different ways to be intimate, or trying new activities together just to allow you both to reconnect. And it's also important to remember that everyone experiences it differently, and some people may find it difficult to discuss intimacy and sexuality after cancer. And if this is the case, it is important to understand and be patient and respect their wishes, and just allow that conversation and communication to stay open so your partner knows it's there whenever they are ready. So I do believe that in order to establish more intimacy after cancer, we really need to broaden the definition of sex. So the first thing I recommend is focusing first on intimacy and sensuality. So you need to get to know yourself again. What sensations do you like? What don't you like? This way you are going to learn your sensuality again, and then you can communicate this with your partner once you feel more confident. Things that you used to like in the past, you may not like in the present. So sensuality is not just exploring your body, and you don't even need to go anywhere near your private parts. It could just be changing the lighting in the bedroom or the bathroom. It could be running a nice bath with some oils and simply getting in, and then just becoming mindful in that moment, noticing how the water feels, noticing the colours of the candles and how they flicker. And every time your mind wanders, just bring yourself back to that moment and just notice the things that you can see, the things that you can touch, the things that you can smell. And this can be very helpful for initially resistant people, just to begin to explore your body, see where you like to be touched now and where you don't, how much pressure you like, or how the temperature feels against your skin. Do you prefer it hot or cold? It can have nothing at all to do with sex, and it's just about reconnecting with your body and mind and deciding what sensations and feelings you like now. That way there is no pressure of needing to have sex or penetration or orgasm. It's about permitting yourself to explore without the pressure of an outcome. By doing this, you are rewiring the body and the mind to see this as a positive experience and not one to panic about. And you are getting out of your head and back into your body. So sensuality is often confused with sexuality. And pleasure is about sensations and senses, and not just sexual sensations. Sensuality is a healing force as it incorporates 4 key areas: mental, emotional, physical, and consciousness. Sensuality allows us to deeply connect with ourselves and then with others. It's also a great way to self-regulate and to release tension and emotions. And a lot of this is stored in the hip and pelvic area. So through having orgasms or releasing the pelvic area, you will release a lot of that emotion and tension. So your mind is the most important erogenous zone. It is the one that connects all your senses, and it is also the place that can shut down sexuality. So there are tons and tons of ASMR videos on YouTube, and it's a really good place to begin to reconnect with your body and to reconnect with your sexual pleasure. It causes autonomous sensory meridian response, I think, giving a person that lovely, tingly and pleasurable feeling. And I would recommend ones that promote sensuality and personal attention. It can help you to reconnect to yourself and feel sensations and accept touch in a positive, non-sexual way. Sensuality underpins sexual pleasure. So you need to reclaim your sensuality first, and your ability to experience sexual pleasure will follow. And there is also something called autogenetic training, and this can be an excellent initial tool. It can be used for stress, anxiety, fear and tension, and regular use can help you feel more centered, relaxed and calmer. It helps you to embody new beliefs and connect your new beliefs to feelings. So I do have a YouTube video for autogenetic training, which I will link in the description box below, and I really recommend that you watch it and follow the instructions. So, changing the definition of sex to increase libido and enjoyment can also alter and open a person up to what sex is. Sex is intimacy, sensuality, touching and kissing. Extending your definition of sex opens you up for more opportunities for sexual pleasure. So a person might not be in the mood for intercourse, but they may be open to other things. And by broadening your definition of sex, it places pleasure and intimacy as the priority and not penetration and intercourse. So just thinking a little bit about connecting with other cancer survivors. So connecting with other survivors can be really beneficial, and this can provide a safe space to talk about feelings and experiences, and it can also provide support and understanding. So there are several ways to connect with other cancer survivors, and this includes attending support groups, joining online forums, or talking to a counsellor or therapist, and that may be one that you find privately or one that is recommended to you by the hospital. So it's also important to remember though that everyone's experience is different, and it's important to be understanding and respectful of other people's experiences and to not compare or judge. There is something called hypno-oncology, which can also help with managing the symptoms and side effects of cancer. And I offer hypno-oncology, so I will just leave the link on my website in the description box below for you to check it out if you're interested. So, in conclusion, cancer can have a significant impact on a person's sexuality and sex life. It can cause physical changes such as pain, fatigue, and changes in libido and sex drive, as well as psychological changes such as anxiety and depression and a fear of rejection. It is important to acknowledge and to address these changes in order to manage them. So there are a few tips for managing the effects of cancer on sexuality and on sex life, and this includes talking to a partner. It includes exploring different ways to be intimate and extending your definition of sex. And it also includes taking things slow and reconnecting with your sensuality first. There are resources available such as talking to your doctor or therapist and joining support groups. And hypnosis and sexual freedom therapy can help you to come to terms with how your sex life has been affected by cancer, and it can allow you to regain your sexuality and intimacy. So I will also leave that link in the description box below if you want to find out how you can regain your intimacy and sexual pleasure after cancer, or at any point really on your cancer journey. So thank you very much for watching. We'll speak soon. Bye bye for now.